Acrylamide, a potential health risk from food and the environment. Acrylamide is an organic compound that forms naturally in some starchy foods when they are cooked at high temperatures, such as frying, baking, roasting, or grilling. Acrylamide can also be found in cigarette smoke, car exhaust, and some industrial products. Cancer risk. Cancer risk. Numerous epidemiological studies in humans have been conducted to determine the association between dietary acrylamide intake and cancer risk. However, these studies have not found clear evidence of a causal link. One reason for the inconsistent findings could be the difficulty in accurately determining the amount of acrylamide consumed based on reported dietary intake. Major international and national health organizations still weigh the potential cancer risk of acrylamide. The International Agency for Research on Cancer IARC has classified acrylamide as possibly carcinogenic to humans Group 2A. This means that there is limited evidence of carcinogenicity in humans, but sufficient evidence in experimental animals. Major international and national health organizations still weigh the potential cancer risk of acrylamide. The U.S. National Toxicology Program (NTP) has classified acrylamide as reasonably anticipated to be a human carcinogen. This means that the NTP has sufficient evidence from animal studies and other research to conclude that acrylamide is likely carcinogenic in humans. Major international and national health organizations still weigh the potential cancer risk of acrylamide. The U.S. Environmental Protection Agency (EPA) has classified acrylamide as a probable human carcinogen. This means the EPA has evaluated acrylamide based on scientific evidence and concluded that it is likely to cause cancer in humans. Workplace exposure. Studies on acrylamide exposure in the workplace have shown that high levels of occupational exposure via inhalation can cause nerve damage. Important notes: acrylamide is created in food at high temperatures, not just during processing. Baking bread, roasting coffee, or even toasting bread all generate acrylamide. Important notes: while clear evidence linking acrylamide consumption to cancer in humans is still lacking, health agencies recommend limiting exposure to acrylamide by consuming starchy foods processed at low temperatures and for shorter durations. Important notes: opting for alternative cooking methods like steaming, boiling, or stir-frying instead of frying, baking, or roasting. Storing food at low temperatures. Consuming starchy foods processed at low temperatures and for shorter durations. Important notes: opting for alternative cooking methods like steaming, boiling, or stir-frying instead of frying, baking, or roasting. Storing food at low temperatures. Consuming starchy foods processed at low temperatures and for shorter durations. Important notes: opting for alternative cooking methods like steaming, boiling, or stir-frying instead of frying, baking, or roasting. Storing food at low temperatures. Conclusion: although clear evidence of a link between acrylamide and cancer in humans is yet to be established, acrylamide is still considered a potential carcinogen. Health agencies recommend limiting exposure to acrylamide to minimize potential health risks.